Hey guys, I'm just hopping on here quick to show you guys an ankle treatment that I did the other day. I will explain it to you, kind of what's going on with it, where we use it, that kind of stuff. It was a pretty bad ankle injury, but I do use a similar kind of protocol and then just adjust it depending on the specifics of the case for any kind of ankle sprains, stability issues of the ankle, stuff like that. So hope you enjoy. So now you've seen the video, I'll break down the different points we're using, what muscles they're in, and why we're doing it. So you'll notice there's a couple needles in about here, a couple down here. We actually had some extra ones down into the ankle, but specifically the one out here is what I'll typically use. What we're doing is, you kind of see it going boom, 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 in and moving out at kind of an irregular pattern there. So the ones on the inside of the leg, we're actually getting into Tibialis Posterior, and we also have Peroneus Longus over on the outside. So those two are controlling your inversion and eversion of your foot. So you got kind of four main movements. You're coming in, out, and then plantar flexion and dorsiflexion of the foot are your kind of four movements of the ankle. So after an ankle roll, typically when you roll it, you're rolling it outwards and having damage to the outside. In this case, it was actually to the inside, but the treatment doesn't change all that much with that because we're still regulating it side to side. So what we do is 2 needles here, 2 needles there, and the reason for that is it just allows us to hook up the electric stim to it on different frequencies because you need positive and a negative to complete the circuit with it. So for instance, this one might be going a little bit slower or faster than this one, and we do that on purpose so that, say if I start this one first, all you're getting is this movement in of the ankle, and then I add this one and it, on a different like cadence, is trying to take the foot out like this. So then you get it going back and forth, and then every once in a while they're going to match up at the same time, and it's going to give them both like pulse there, but it's not actually going to move anywhere. It's just going to sit still for a second. So why we do this is it creates basically like a chaotic signal for the brain, and it has to sort out again like what's going on with my ankle. After you've rolled it, there's protective mechanisms, and it's just like doesn't want to move anything. It's not sure where it's supposed to be in space, and we're just resetting those muscles and that ankle joint. And then you'll see the little one, a couple little needles kind of right out into this area, and that's going into your ankle joint itself. The ankle is one of the most proprioceptively dense areas of the body, the other one being like our neck, our head, because of just telling us where we are in space. Think when you're running or walking even, especially on uneven ground, maybe you're a little this way, that way, there's a root midfoot, how your ankle is constantly making small little adjustments to the ground that you're running on so that the rest of your body can still function normally. So getting needles into there really helps with the proprioception of the ankle, and depending on the scenario, we may or may not put stim on that, but always wanting to put stim on the ankle or on the calf so that we're getting that in and out movement, if that makes sense. Typically where I'll use this is right after an ankle sprain, or if somebody's constantly having repetitive ankle strains, even if they don't have one at the time, it shows that their ankle, the proprioception's not there. There's a weakness in the ankle or compensation pattern or something going on that's causing them to have that repetitive ankle sprain. So that's another area that we'll use it. Or if they're just, hey, I have really poor balance, those are one of the areas that we want to start working on. Start with some balancing exercises, start working on that ankle, and then also looking at other options like the visual system, the vestibular system, like what else is going on that's contributing to that lack of balance and awareness of the body, where it is in space and time. Hopefully that's a little helpful for you guys. You can see a little bit of what I'm doing with acupuncture in the treatment rooms. And if you have anything else you want to see as far as treatments, if you want to see a knee treatment, hips, anything like that, you can always comment below and we will try and get something up there for you.